So a warm welcome to you all. This is the webinar for the Master of Science in Epidemiology, which is run at Imperial College London. I am Marta Blangiardo. I'm the course director for the program, and here with me I have Sungano. Sungano, do you want to present yourself?
Yeah, my name is Sungano, and I'm a principal teaching fellow. I'm the course organizer for this MSc.
So the master is run by the School of Public Health at Imperial College London, and today I'm going to start giving you a flavor of what you're going to focus on if you join the program, and then I'm going to leave the floor to Sungano, who's going to go deeper into the structure of the program. Can you go to the next slide? Thank you. So at the core of the program, there is the name epidemiology, which comes from the need to understand what is good and what is bad for population health. Epidemiologists and scientists are on the news, are answering questions about why do we see a certain disease appearing, what could be a risk factor for some other diseases, why do we see differences in the vulnerability of population, and so on. We have seen this all over COVID, which would have been it's already 5 years ago, but it's still quite fresh in our memory, I suppose. And the range of questions that epidemiologists were asked went from why did COVID appear all of a sudden, and why do we see people being affected in such a different way across the world, and do interventions like lockdown work, and so on. Now, obviously, this type of questions you can ask for any other disease you can think of, any other risk factor you can think of, any other any population you can think of, right? So we could think of air pollution. Is it bad for mental health? Is it different in the relationship between air pollution and mental health is different for children, for adults, for older people? Is diet, a specific diet, a risk factor for cancer, and so on? Next slide, thank you. So in a nutshell, the definition of epidemiology is the study of the distribution and determinants of health-related states or events in specified population, and the application of this study to the control of health problems. As you can see, this is really, really broad, and it covers non-communicable diseases and communicable diseases. It covers environmental determinants, social determinants, genetic determinants, behavioral determinants. It can cover interventions and policies. All of this is epidemiology. It also covers the methods that are used to understand how a disease changes in space and time, how and why different people are more or less affected by a specific disease, and things like that. So really, if you're coming to the program, you're going to see all of this, and then you're going to have the opportunity to tailor, to decide what is the question you're most interested in, and spend the last part of your study looking at that in detail. And this is something that Sungano is going to talk about later. Next slide, thank you. So let's go back to the beginning. And this is John Snow, this guy on the left, and he's considered the father of epidemiology. He was a clinician who was living and working in London in the 1800s. And at that time, at some point, there was an outbreak of cholera cases in London, in a specific part of London, in Soho, which is now a really quite cool part, full of restaurants, full of theaters. So if you have the opportunity, it's great to go there. But back in the days, it was quite a poor neighborhood. So the common theory was that all these cases of cholera were due to the air not being very good. So it was something to do with the air. But he was not really convinced at all. He was very curious, and he actually wanted to find evidence, okay? So what he did was he went around the neighborhood and started mapping where the different cases were, which is on this map. You see there are these little squares and rectangles, is where actually the cases of cholera were. And what he found out was that they were all clustered around this big red dot, which is actually a water pump. This is one on you can see it on the right, it's obviously been refurbished, but it's still there. So again, if you're coming to London, it's a good opportunity to go and see where epidemiology started. So actually, he realized that this water pump got water from the Thames, and that section of the Thames was polluted. So there you go. Actually found out evidence that the cause of the cholera outbreak was in the water. So he's considered the father of epidemiology, and he's also considered the father of spatial epidemiology, because he was looking really at the map and seeing where the different cases were compared to this point source. Next slide, please. Now, over the century, epidemiology has become a major field of research to understand causes of diseases, and something I've already said, these causes could be behavioral, could be lifestyle, could be environmental, could be social, and so on. To describe how a disease change, for instance, in space and time, as seen here in terms of mortality for cancer, across a long period and at a very detailed spatial resolution. Also to study the history and prognosis of diseases, so understanding why some people get the symptoms of a specific disease, then this disease gets worse, and then they maybe end up in hospital or even they die, and some other people actually get in remittance, for instance. And also to evaluate policy intervention. This is also crucial to try to reduce the incidence and prevalence of specific diseases, ultimately trying to eradicate them. Next slide, thank you. So during the course, the course, you will become a master in the methods used to find the causes of health outcomes and diseases in population. And here are some examples of questions we may, look at during the program. Some are really quite broad, like what diseases kill us and make us unhealthy and why? How do we know that? Where is the evidence for that? Some are very specific, like, have we beaten the COVID pandemic? Is there going to be another one? Where some specific viruses come from, like HIV, Zika, or COVID, SARS-CoV-2 and Mpox. Some really look at the why we see things which are different. So why life expectancy is so different across the world, or even within the same country, and sometimes even within the same city. Why do we see that? What are the factors affecting that? And finally, also looking at treatment and medicines and trying to understand why a specific treatment may be working in a better way than another treatment, and how do we say that? Next slide. So you're gonna be joining a leading institution in the world, Imperial College, and also a department, the School of Public Health, which is at the forefront of epidemiology and public health research. There are 2 medical research council funded centers within the School of Public Health, one in environment and health research, which works more on non-communicable diseases, and another one on global infectious diseases analysis, which, as the name says, works more on infection diseases. There is also a health protection research unit in radiation, which has been recently funded. We are very active in terms of research, and here there are some examples of research which is happening within the School of Public Health. So we work on air pollution, for instance, and on cancer and microplastic, which seems to be one of the next big risk factor for health. But also, obviously, we're still working a lot on COVID, but not only on COVID, on the infectious disease side, we also work on other viruses. We work on dengue, we work on Zika, chikungunya, and many other polio, and many other sort of like infectious diseases. Next slide, please. We also have a very active engagement with government and policymakers. Here are some examples. So we were involved in advising the government, the UK government, on the link between aircraft noise around airports and cardiovascular diseases. And this was to try and decide if a third runaway was to be built at Heathrow. At the same time, we've been working with the Chief Medical Officer and also with the Mayor of London around air pollution, and particularly around the ultra-low emission zone, so the clean air zone, to try and reduce air pollution, and also trying to see how this reduction has an impact on health. Next slide. At the same time, the Center for Global Infectious Disease Analysis has been at the forefront advising the government during the entire COVID pandemic. The modeling done at Imperial College was the one used by the government to try and estimate the cases, so the incidence, the prevalence, and also to sort of like trying out, estimating the dynamic of the disease. And also, scientists from the infectious disease epidemiology department were advising related to non-pharmaceutical intervention, like for instance lockdown. But besides COVID, experts from the department were included in a task force on, for instance, on the monkeypox outbreak, which happened 3 years ago already, which was put together to try and advise again the government about how to deal with the disease. Next slide, please. We also, across the School of Public Health, have a very active research on methods, on machine learning, statistical and mathematical tools to answer the epidemiological questions. As I said, this is also a core part of the MSc. So here are two examples, one on the left looking at the different variants of the different COVID variants and how they were competing and how they were evolving in time using machine learning methods, while on the right is an example of a spatiotemporal model which was developed to understand the impact of high temperature and heat waves on chronic obstructive pulmonary diseases across England. Next slide, please. Thank you. So obviously epidemiology, but also multidisciplinarity is at the core of the program. You see here lots of words, and there is something about outbreaks, something about cancer, epidemiology of aging, environment, genetic, inequality, health disparity, modeling, which I said is an important component, but also an opportunity to learn about public engagement with patient-centered outcome research and patient-reported outcome research. So all of this is covered in the program, and our ambition is to train the next leaders in epidemiology.
Thank you very much, Marta. I think I will pick up from here and then go on to talk about the course in more granular detail. So this is what you should expect from the MSc in epidemiology if you are to take it next year. If you have any questions about the program as I'm speaking, please post them to the Q&A so that they're addressed by our colleagues that are in this meeting with us right now. There is a lot of information as well later on that you can find on the course website. And we added more detail, particularly around the modules and the structure of the course, that will help you or give you some idea of what the course is about and what to expect from each of the modules. So I'm going to identify some modules here, and there's some descriptions of them on the course page. So I'd encourage you to visit the website if you have not already done so. The MSc in epidemiology is a 1-year full-time program. It's quite intensive. And it is structured like this. You start with core modules or introductory modules to epidemiology, and these are termed, all of them in term 1, as compulsory modules. So you have 4 compulsory modules. Then in term 2, you can go on and build on skills of interest, so advanced skills in modeling and stats, through elective modules. So term 2 is dedicated to elective modules only. And then finally, term 3, which starts from about April to August, September, is the research project term. So you spend a full 4 months on your own research project, ideally utilizing skills that you have developed through the compulsory modules and the elective modules in term 2. So most of the intended learning outcomes of the program are assessed through the research project. Compulsory modules are introduction to statistical thinking and data analysis, principles and methods of epidemiology, research methods, and an introduction to infectious disease modeling. Everyone has to take these modules. Most of them are quite quantitative in their approach, and you will be expected to demonstrate quantitative skills through your research project, given what you're going to be taught in the first term. There is less of an instruction on technical approaches to quantitative analysis, but you will get an introduction to the philosophy and approaches for quantitative research through the research methods module, where you will also be taught qualitative and mixed methods for research. You will have additional sessions or seminars throughout the term. So it's a packed calendar, and where we can find time or where we can find slots where we can give you more information on academic skills, such as ethical use of AI, academic skills around writing, academic writing, and then preparation for PhD applications. We incorporate all of these seminars as non-credit bearing or as seminars and tutorials. So this is a packed term that is then followed by the electives in term 2. So this is how things fall in term 1. I've given you a list of all of the modules, and this is how they're presented to you. There is a specific day of the week for each of the modules. Monday for intro to stats always, Tuesday for principles and methods of epi, and so forth. Wednesday is your free day of sorts, but we've incorporated a new module this year, which is for R coding, because some people come with, or everyone comes with variable R coding skills, and a lot of R is used on the program. So we now have a standalone non-credit bearing module called R coding support, which takes place on Wednesdays from 10 to 12. After that, there's also optional maths that's delivered by the same module leader, where you drop in, you ask any questions that you'd like about maths that supports your understanding of concepts taught, particularly on intro to stats and intro to infectious disease modeling. So if you need help to sort of upgrade your skills or refresh your memory, those are optional sessions available to you. Then we also have seminars, and Wednesday afternoons are also for extracurricular activities. So if you're into certain sports or skydiving or whatever, Imperial has a lot of activities that you can take part in on Wednesday afternoons. You could, in theory, take part on other days, but your teaching schedule is so packed that the Wednesday afternoon is really the only one that you can take part in these. So you have induction in the first week. A lot of stuff happens at college that you can do with students from other faculties. Most of it happens at South Kensington. And then from the second week onwards, you attend classes up till the Christmas period, have an assessment period or months or weeks, actually, and then go on into term 2. Term 2 is made up of 30 credits. And I should have said this earlier on, that your whole master's program equates or translates to 90 European Credit Transfer System credits. So you have 30 in term 1 through all of your compulsory modules, which are 7.5 ECTS, and then you have to get another 30 from term 2. And you can only take those 30 and no more. So you select modules that add up to 30 ECTS, and you're expected to pass those to progress to the research project and to complete the full MSc. These are the options available to you, and most of them are made up of 5 ECTS and run for 5 weeks. So you have a block, first half of term, where you have 5 weeks for modules, have a little break, and then continue after that with another block of different modules. The only one that falls over the full 10-week period is the Bayesian reasoning and methods for spatial temporal data. That's led by Professor Blangiardo here and Dr. Monica Pirani. All of the other modules are 5 weeks. So it's up to you what you select. You have free choice. The only one that you would have to select with one other is the outbreaks module, for which you must first take the further infectious disease modeling module to take outbreaks. So that is the only module that has a prerequisite, the outbreaks. You must take FIDM first. Otherwise, you can combine these as you wish. It's ideally got to be coherent and to support your research project plans. Some of these modules are shared with the Master of Public Health, such as nutritional epidemiology and environmental epi, as are 1 or 2 of the term 1 modules. This is how your term 2 modules fall. So as I mentioned, Bayesian falls over the full 10 weeks. So that's always on a Monday, you have the Bayesian modeling module. And then everything else falls on a specific day, but only for a 5-week period. Some modules are on the same day, such that you can only select one or the other. So currently, emerging and neglected tropical diseases falls on the same day as nutritional epi. This schedule is not always going to be the same year on year. We make some adjustments based on student feedback and based on requirements from module teams or course teams, and for adequate delivery to you. Currently, this is how they're structured. And so you would only be able to pick one or the other and ensure that there's alignment across the modules that you're taking. In term 3, finally, you have the 4 months for the research project, as I mentioned, and this is a full 30 ECTS. The main assessment for this module is a written dissertation, which used to be 10,000 words, but has been reduced from this year to 5,000 to 7,500 words. So you're meant to submit a written thesis of your work with a word limit of 5,000 to 7,000 words. In addition to that, you would have a background presentation detailing your plans, and this is an assessed component, as well as a final viva, which is also assessed. The detailed breakdown of that will be given to you once you start the course. Altogether, this makes up 30 ECTS. You're offered project choices by academics in SPH, that is the School of Public Health. And I'm going to go through the departments within SPH. It's kind of misleading that the School of Public Health is identified as a department which also houses specific departments. So I've had queries from people about departments that they were interested in, which they didn't recognize as being part of SPH. And I'm going to go through all of the departments that are under our purview, where you can complete, or who you can complete a research project with. So all of these departments submit projects, and you would have access and a view of all of these projects that they make available, not just to you, but also to the Master of Public Health and the MSc in Health Data Analytics and Machine Learning. Based on the skills required for that project, they would identify which program it suits. And in quite a lot of cases, the program, the project does suit the MSc in epidemiology. So we're in a good, lucky place where we tend to have projects submitted that satisfy the quantitative requirements for this program. You can also propose your own research project, and we'd encourage you to start thinking on this and to think of something that you're interested in that can be supported by academics in SPH. So whatever you're planning to do or whatever you'd like to work on should be something that can be supported by an academic in SPH, because one of your supervisors must be from the School of Public Health. And to know what we can and cannot support, I will point you again to the research departments that we have so that you know the work that is ongoing. But you can do additional work yourself and identify individuals, look into their profiles and as well as their research portfolio to work out if what you're thinking of doing is aligned to what they're currently working on. Projects can include secondary data analysis, and that's usually what we have, and the simulation of data. You can have a literature review, but it also must have a quantitative component. So some additional feature of modeling or meta-analysis, because you must demonstrate the quantitative skills that are introduced to you in the first term. So these are the departments that we have in SPH, and I've listed all of those, the department leads and the research activities or the research that they mainly focus on. Historically, based on how the MSc in Epi came into being, most of our projects were aligned to infectious disease modeling, because MSc in Epi was born of the infectious disease epidemiology department. However, we now have input and teaching from all of the departments that you can see here. So now Epi students can select modules or can select projects from any of these research departments. All of your modules are taught by people that come from these research departments. So the skills that you'll be gaining are aligned to the work that's being conducted there. But more likely, more of your skills would be aligned to infectious disease epidemiology, epidemiology and biostats, which is where Professor Blangiardo sits, as well as the environmental research group. There are some projects that would be of interest and that you can take that also come from primary care and population health. And we do get several projects of interest from the clinical trials unit and aging. But the most popular departments for your projects are IDE, Infectious Disease Epidemiology, EBS, the Epidemiology and Biostats, and the ERG, Environmental Research Group. And this was a group that used to be at King's and migrated to us about 5 years ago. And they're quite research active and encourage projects. You will also see that they lead a couple of modules in term 2. So do pay attention to the research topics that are covered by these groups and consider if there are research areas of interest to you. And if they are, I'd encourage you to start looking at who's doing what and to consider what you could start working on your research project. As said, these are people that will be teaching on your program, so you will likely meet a lot of the instructors and academics that will provide projects to you in term 1, and you can start having conversations with them about your research plans and ideas. I know several students now are communicating with professors and academics within ID and ERG, potentially in EBS as well. So your dissertation journey goes like this. Ideally, it starts before term one. It starts now through this conversation that we're having. You start thinking about what you'd like to do. And then once you join us, you have the compulsory modules that give you the core skills that you need to complete your research project. You start working on developing a research question, which can be an iterative process. So you might have an idea of a topic, then you start discussing with the academics potential ideas of where to take that topic to address a specific and feasible question. So something that you can answer within the 4-month period of your research project. And this might be a back and forth that takes you through the first term. You don't have to do this, but it is encouraged, especially if you want to work on something that's of interest to you beyond the MSc. Because we will give you a list of research projects that you can select from around January, February time. It will give you the list of research projects. You then compete with other students for those projects. Some are more competitive than others, but generally there's a requirement for you to submit a motivational statement, so justification and explanation from the supervisor for why you would be a good student to complete this. Then there's a selection process. You meet up with the supervisors and also consider if you would like to work with them. All of these should be finalized by April, which is when you begin working on your research project. You submit various drafts, the first one of those being a summative assessment of your background, of your plans. That's the background presentations. That's the first summative assessment that I mentioned. And then, of course, you're submitting drafts to your supervisors through May, and submit your final draft in August. We have a lot of seminars throughout this term to support you with work on your project. So we have seminars on the write-up, seminars on supporting your data analysis, and then encouraging you to publish your work. There is a prize for the best project, encouragement to publish, as said, and also I encourage you to be strategic and to consider how you can align your research project to your career plans. Several students have gone on to work in research that aligns to their research project. So in careers with local authorities and so forth, based on what they did through the research project, and I'll touch on that just now. These are some of the projects that were completed by students. So people that were in your place, then joined us and selected projects that were either provided by academics. So the top list were all projects that were either proposed or co-produced by academics. You can see there's a good mix of those. UK Biobank one would likely be from Epidemiology and Biostats as a department, but several of those are from Infectious Disease Epidemiology, one from PCPH, as well as the Environmental Research Group as mentioned. Of interest, I included some student projects right at the bottom there, and all of those were developed in term one. The modeling of OV16 seroprevalence for onchocerciasis control and elimination was completed by a student who is now working with the supervisor, Professor Maria Gloria Bassanes, who's the lead for emerging and neglected tropical diseases. They co-developed this proposal together. So I approached her in term one and they started working on it together. They completed the project, they've published it, and he's now joined her team as a research associate. Similar things apply to those that completed projects after this. And you would recall the pesticide and pancreatic adenocarcinoma project, Marta, because this was co-produced by you and a student who's now completing their PhD with another institution in France aligned to this. And the HIV prevention and testing rates. This was a student from South Africa who was interested in these strategies specific to South Africa, came and joined us, completed their project, and was co-supervised by Dr. Jeff Eaton. Now, at least, maybe not currently, but after they completed their project, they worked as a research associate with the team in IDE. Finally, similar thing with the project that completed the West Nile virus project, went on to work on a similar topic with lead supervision, and they affiliated to the London School of Hygiene, but co-supervision by Imperial academics. So this is something that you can work on based on your interests, not just for now, but longer term, which can be supported beyond your time as a student on the MSc in Epi. So you could go into a research role as a research associate or complete a PhD, but also use it to justify your suitability for a job or role in another setting. We'd hope that when you come out of this program, you have a good understanding of public health and public health research specifically. In particular, we want you to have strong data analysis or quantitative skills, understanding of statistical methods that are used in epidemiology, and a proficiency of using, in particular, R. Beyond that, we'd like you to have very strong critical skills, through critical thinking skills, and that's something that's encouraged through all of the modules that you're going to be taking. We make a start on that through the approaches for teaching or of teaching through term one, where we have a lot of interactive sessions, journal club sort of scenarios where you get to critique and apply the methods that you're being taught. So you critique these as published by others and then critique your own work as you're going along. And these are the skills that we then hope you come out of it as an all-rounded professional in epidemiology. A lot of our students go into research, so about 2/3 at last count. Some of the data is slow to come to us in terms of the endpoints of former students, but as far as we know, quite a lot of students go into research. They may do so, as mentioned, as research associates, either with us or other departments. So one of our former students, actually the best student last year, is now a research associate with a team at UCL. That was based on the particular research interest that's there. Get a lot of job calls or PhD calls through similar or friendly institutions. So students do go on and complete their PhDs or research roles, not just at Imperial, but beyond. But you get a good grounding, and there's a respect of being an Imperial student from those institutions because they know what we teach you and they know what to expect of you when you leave us. Several do PhDs with us, so they start talking about these and they look out for calls. We have a PhD seminar actually this afternoon because most of the PhD calls go out around the Christmas period. So this afternoon we're talking to students about PhDs. They're having presentations from former MPH and MSc, NEPI and HTA students about how they got into those positions. Several of our students have received the President's Scholarship to go on and do PhDs at Imperial. So that's within your reach because we know that our students have achieved or acquired that. And they will also be talking about funding and approaches to applying. So quite a lot of our students are empowered and equipped to go into PhDs. Several are in local authority. We have had partnerships for research projects with different local authorities. So those students have then gone on to potentially look for jobs or work there. So even when they have not worked with the local authority in their time at Imperial, the local authorities, Brand, Hounslow, and so forth, are familiar with the sort of students that we send out. Beyond that, a lot go into analyst roles or epidemiologist or public health analyst roles in environments such as the UK Health Security Agency. And once again, this is a common route for our students because Imperial students have done well there. So there is a favorable outlook to them. Cancer Research, World Health Organization, Gavi, various organizations, also pharmaceutical management program at Novo Nordisk, one recent student, and also other roles in pharmaceuticals, AstraZeneca, and consultancy. That's another area that tends to be of interest. So the endpoints are many, but most choose research. Now, the application process. This program is quite competitive. So we get quite a lot of applications for the number of spaces that we have. We get 200 to 300 applications annually for 25 to 30 places. Our application portal opened about a month ago, and already we have filled 4 of our 25 to 30 places. That means we have received about 4 times that number of applications, about 20 since we opened, and 4 places have been offered and accepted. So just to give you an idea of the amount of time that you have to work with and play with, if we continue at the same rate, we would likely close around the time that we tend to, or maybe earlier, May, June. Sometimes we have closed as early as April in the past. So I'd encourage you to apply early if you would like, or if you're considering studying with us next year. We review our applications on a rolling basis, and we aim to review those within 4 to 6 weeks. We've been doing quite well at returning decisions quite quickly. Application requirements. You should have at least a 2-1 degree in math, statistics, medicine, biology, or biological sciences, or a related field. Importantly, you should demonstrate quantitative skills or aptitude so that you can show clearly that you can keep up with the demands of the course. So usually that comes across through your transcripts where you've taken introductory modules in statistics or similar. but you can demonstrate these skills elsewhere. So if you've been involved in collaborations, publications, or taken courses to support your quant preparation, then do submit this as demonstration of your quantitative skills. Of course, you should have an interest in public health research, and you should be able to demonstrate that motivation to say you want to do this work for this reason. Ideally, it should be aligned to your background. It's harder to justify saying you've always been interested in public health and then have taken a totally disparate undergraduate degree, but it's not impossible. As long as you can tell a personal and cogent story of why you've taken the route you've taken, and then importantly, explain to us how we can support you with your future goals, then the motivation for taking this program is made clearer to us, and we can also work out how well to support you and your suitability, therefore, for taking the program. We have a higher requirement for English language skills, so that's IELTS 7 or above or similar grade, and detailed CV showcasing what you have done, what you're capable of, then strong letters of support from people that you've worked with, at least one academic letter of support. So I would once again highlight that the personal statement should be something that communicates who you are and why you want to take this course, because a lot of import is placed on that. Now, at this point, once again, I would then also stress or point out that with the use of artificial intelligence, it's easy to think you can get that generated and presented nicely for this application based on what we say we look out for on the website. However, if it doesn't speak to everything else about your profile, and it's very hard to justify how this beautiful personal statement speaks to all of the other documents that you submitted, it's then harder to justify giving you an offer. It makes things confusing if we can't actually tell who you are behind the statement that's submitted. So try and make it as personal as possible and as authentic as possible. Do not just get a generic statement generated through AI, because it just slows down the review process for you and us. Usually if we can't really get an idea of why you want to take the course, we may have an additional conversation with you. So invite you to interview, and the interviews are generally quite informal, to just say, why do you want to take the course, and to help get understanding of what you have in your CV and how it speaks to your personal statement. And this process may not be necessary if all of it is clear from the outset from what you have written in your statement, and it correlates with what you have in your CV. So you may be invited to interview, but it's not absolutely necessary. I don't know if there's anything that you want to add on this point, Marta.
No, I think you have said, all that needed to be said. It's
great.
very clear, yeah.
Okay, thank you. We've had some challenges, and we have these documents that are presented and look like they're AI generated. And of course, we're not aiming to prove or disprove that you have generated them through AI, but they don't read as something that you would write, given everything else about you and your profile. So these applications are reviewed by individuals. So it's ideal that you try and communicate to us. We will have a part to play in the review of your application. So please do recall that we have said this in this meeting. There have been questions in the past about funding opportunities and scholarships. So I've collated the scholarships that are advertised through Imperial. There are additional potential scholarships that you can look into that are beyond Imperial space, but these are the ones that are listed on the Imperial scholarship fees and funding pages. Some of them have not opened yet for next year, but several of those already have deadlines set and are clear. So for instance, the Sanctuary Scholarship, that is for refugees or people in who have humanitarian or protected leave, that closes in April of 2026. That's the specific date that's on the scholarship page. If you go on there and select postgraduate and choose public health for the School of Public Health, you will see the scholarships that are relevant to you. There's several others that are newish or evolve, such as closer to the bottom, the 5 great Imperial scholarships. Those contribute £15,000 towards your tuition, and the countries or the eligibility varies each year. And I checked this year that these are open to applicants from France, Egypt, Ghana, and Nigeria. So if you're from any of those countries and needed funding, do consider the Great Imperial scholarships. this is part of the tuition, but not all of it. So it's not even half of the current international scholarship of the international tuition, but it is quite a useful chunk. Other ones, the Student of Black Heritage and Scholarship for Disabled Students. These have been refreshed year on year. I have a deadline for the Student of Black Heritage, but not the Disabled Student Scholarship. And these both cover full home tuition. So as you see from the headings I put on there, some cover full tuition, full overseas tuition. Look out for those, and then several only cover home tuition or will be open to you. We have the School of Public Health Scholarship and the Dean Scholarships that are usually made available each year, but we don't have those posted on the site yet in terms of dates and deadlines, but do look out for those. These slides will be shared with you, so check these scholarships later if this is something that's of interest to you. In terms of things that might be of interest to you, we've also got some recommended reading and listening, and there's some books that make epidemiology and statistics quite accessible. So getting an understanding of how epidemiology is applied and how statistics contributes to research. Art of Statistics, Professor David Spiegelhalter, and he gave a talk at Imperial recently. I say recently, it's over a year ago, but he came and spoke with us, as well as Ben Goldacre also gave talks at Imperial, just explaining what good and bad research looks like. I'm from the Michael Marmot School of Social Epidemiology, so I'd always recommend the Fair Society Healthy Lives because I completed my PhD with UCL under that department, considering the social determinants of health. We focus a lot more on infectious disease, epidemiology, as well as chronic, as in the departments that I showcase, but all of these things would give some idea of what epidemiology is about. So if you wanted to get some additional reading, there were some more complex ones on genetics that were incorporated by the team. So it just depends on your areas of interest. We've just compiled this for you. If you have any questions about the program, so have questions about your eligibility or specifics around what's taught, anything that you want more clarity on before you submit your application, please contact us via email. So you can email the MSc in Epidemiology shared inbox or email me directly. So the MSc in Epi emails do end up coming to me, but as we've had this talk, you can also see contact details on the course website and email us directly. That's myself and Professor Blangiardo, and we'd be happy to address any questions you'd have. So I think I'll stop right now and then address any questions that are still pending in the Q&A. So I don't see those yet. May you confirm that there are no open questions, Joe and Sylvia?
None at the moment, no.
None at the moment. Is that to say there are no questions in the room? Because we'd encourage you to ask questions if you have them, still got some time. So this question around students that we take straight out of undergrad, a few years experience, it's a good mix. Quite a lot of the students we get are straight out of undergrad. And so that there should be nothing to stop you from applying right away if that's of interest to you, just justifying what you were doing in your undergrad and anything else that you've done before that, or at the same time supports your preparedness for this course. But we get a lot of students that have just completed the programs I've mentioned to you. Is there anything that you'd like to take, Marta?
So there is one on how the course balances technical side of epidemiology, like statistics and coding, with the more conceptual side of public health, which is a very good question. And hopefully from what Sungano was saying when she presented the kind of different modules and what's the structure of the program is kind of like, you know, it could be seen there a little bit. So basically modules, there is a combination, really a combination of, you know, more technical modules and more kind of fundamental of epidemiology, from an infectious disease perspective, chronic disease perspective, research methods, as Sungano was saying, particularly in the first term. I would say that each module has a little bit of everything, right? So there are, even the technical modules are always very much driven by the epidemiological and public health applications. So all the examples, all the practicals, the homework are all based on some public health or epidemiological questions. So that really there is the opportunity of seeing how the two things are combined. And at the same time, if you look at the more chronic disease epi or infectious disease epi modules, they're really sort of like always going back to what are the methods that are needed to answer this question. So it's all really very much interlinked. The code is obviously very important, and as Sungano said, we're very happy this year that there is this additional module which is not assessed. It's really just an opportunity for students who may not have been so strong in coding before to catch up, because obviously coding is an important part. But again, this is really very much connected with the methods and with the applications. So yeah, hopefully that answered the question.
Thank you, Marta. I think there's a final one that, that's a very good question. And I think a few students do have questions about nutritional epi as a department and for research projects. So we definitely do have a nutritional epi module that's taken by MSc in epidemiology as well as MPA students. And this is co-led by the program organizer, senior teaching fellow on the MPH. They don't belong to a research department, but they're research active and collaborate with mostly partners from primary care and population health, as well as other departments beyond SPH. So they tend to co-supervise projects on nutrition. It's less obvious who you can propose nutrition research projects to, but we actually do have several projects that complete nutrition projects. And you can potentially find some of this work and projects within research groups in primary care and population health. So it might be something that's more aligned to child health within PCPH, but has a strong nutrition feature or focus. Or with Professor Gary Frost's team that's beyond SPH, but has collaborations within SPH. So this may be harder to find. Have a look first at PCPH. The aging unit also does some things that are focused on nutrition. Any one of the research departments, and actually, UK Biobank also has, so EBS, they're the ones that recently did, how could I forget, the biggest projects on diet, coffee consumption and consumption of other foods and how they impact health outcomes using data from Biobank or EPIC. So if you look at epidemiology and biostats, you can get some nutrition projects there, but we don't have a specific nutrition or nutritional epidemiology team or department. We definitely support those projects if they're of interest to you. So the differences between this course and the EPI course at the London School of Hygiene, I think there are a lot of commonalities. I haven't looked at it and what it looks like right now. I did take some standalone modules, so say the epidemiology and the statistics modules a long time ago. So I know that the content is quite similar. The main differences usually then come into the context that they're set in and the research projects that you'd complete post that. And usually things are set and steeped in what the instructors themselves work on. So the research that the instructors for that module are taking are then aligned to the sort of examples in the context that they set their the epidemiological concepts in. There's also some difference in how the MSc at LSHTM is organized, in that there is the way that the core and elective modules are set out. Maybe just to focus on what I know, which is this program, is that we have this jigsaw idea. So we have the jigsaw approach to getting the course to come together, where we have the compulsory modules marrying up at some point with the electives to give you a solid picture of the expectations or of the skills that you can apply in your research project. So everything is related and aligned. And I'm not so sure that there is that direct link between all of the modules that you were taught at LSHTM and how they set out their intended learning outcomes in their curriculum. But with ours, everything is meant to make sense altogether and support your independent research activity, as in the research project right at the end. So I hope that answers the question about the LSHTM EPI course. As I said, I haven't looked at it in any detail more recently, but I do know EPI concepts are EPI concepts. So you're taught those. Attributable risk will always be attributable risk, but you will be taught this within the examples of, or within the context of the instructors. And we have a cancer epidemiologist as well as Dr. Philippos Philippidis, who's in primary care and population health. So quite a lot of the examples come from those spaces. When you select your 30 ECTS in term 2, good question, will we still be able to access material from other courses or other modules too? And the short answer is, in real time, no. But potentially later on, if they're of use, you'd have to justify why you'd want to access that material later. And then we can ask module leads if you can audit or view their modules. Because they're not part of your credit bearing, they don't contribute to the credits for your masters. You are not allowed to take additional modules as they disrupt the delivery or interaction or group activities for those that are taking them as credit bearing. So normally we don't let you audit or access other modules while they're in session, while they're being taken by other people that are taking them for credit. But after that, if you realize that nutritional epi is something that would contribute to your successful completion of the project, we can approach the nutritional epi module leads or the Bayesian module leads and say, we have this student that's completing this project, they're asking to view your content. And then you would not necessarily have support from the module teams because you were not taking the module as credit bearing, but you'd have access to the material that you require to complete your project or for whatever reason that you have set out. So that was a lot of questions, and good questions at that. We've still got a bit of time, so there might be more to come. But if nothing else is posted, I'd hand back to you, Marta, to decide if we're going to close early or stay on until for another few minutes, see if anything else comes up.
I'm happy to wait another 2-3 minutes if someone, is still thinking. And there's like a last minute request for clarification or anything like that. As Sungana is saying, we're still quite ahead. So maybe I'll just reiterate in the meantime. So what Sungana was saying about being, if you decide to go ahead and apply, really put a lot of effort on the application, being sure that it's a personal application and that really speaks about yourself and why you're passionate about this. Oh, there is a question actually.
Yeah, opportunity to come and visit the uni in person. So for that, I am your tour guide. So yes, there are opportunities to come and visit in person. So we'd have to set up something. Marta, you'd remember I recently showed someone who was considering the program. He's from the US and was visiting for a short time. So as long as you plan in advance, when we align our schedules, I can show you around so you can see the teaching spaces. So contact us again through this email that's on there to set that up. There are also tour groups, I believe. I'm not so certain, but I think they're just general tour groups that show you around South Kensington. So there'd be tours of the main campus areas around South Kensington in groups. What we'd mainly be able to show you are the teaching spaces in the School of Public Health, so things specific to this program.
Okay, I think if there isn't, so there is a message from Joe, okay, with a website for application fee waiver to see if you are eligible, so maybe have a look at that. And I think as is 5 to 1, if there aren't any more questions, I think we can close the webinar. I want to thank you for your attendance, and hopefully you found this useful. And as Sungano said, if you have any other question, you want to discuss something, you want to clarify something, just feel free to reach out, and we will answer. And again, if you are thinking of applying sooner rather than later. And yes, and thank you very much. Sungano, do you want to say something else? Or?
Oh, nothing else. I also want to thank everyone for their time and attention, and thank you too, Marta.
All right.
Thank you,
Thank you. Thanks. Bye.
Bye.